We're speaking with local healthcare experts after Missouri temporarily stops use of the J&J vaccine.
At least 6 cases of a rare blood clot disorder have been linked to the shot. Now, all of those patients were women. So far, more than 7 million doses of Johnson & Johnson's vaccine have been given to patients across the United States.
Let's bring in our guest tonight. Joining us tonight at 6:30 is Dr. Robin Blunt from Boone Health and Ashton Day from the Columbia Boone County Health Department. Welcome and thank you both for joining us tonight.
Thank you.
So let's just start off there with news about the Johnson & Johnson vaccine being put on hold right now. Let's start with Ashton Day. Any effect, noticeable effect on the overall vaccination effort in Boone County because of this?
We're not seeing any effect yet. We're hoping that we won't. We didn't have a ton of the Johnson & Johnson vaccine coming into Boone County. A few of our local vaccinators had it, but not a whole lot. So, we still have plenty of Pfizer and Moderna going around, so we're moving forward with that.
And Dr. Blunt, how many doses of the J&J vaccine were given out by your organization from the beginning?
We've actually only received two allotments of J&J. We received 1,000 doses several weeks ago, and in fact, it's been 3 weeks since the last time we gave a J&J dose. Unfortunately, we had 1,500 doses that we were planning to give out tomorrow, but we put a pause on that per the appropriate recommendations. But we have plenty of Pfizer. We will continue to have vaccine clinics. We just won't be giving J&J until we get further information and go ahead.
On those 1,500, Dr. Blunt, were those people rescheduled using a different product? What is going to happen, and what's the communication like with those people who had something maybe scheduled?
Yeah, again, this came out just a few days ago. The first thing we needed to do was notify them that we would not be able to vaccinate them tomorrow. We couldn't immediately substitute the Pfizer at this time. So we'll be setting up clinics in the next week or so, and they'll be those openings will be available to those folks.
And Dr. Blunt and Ashton, at last check with the Missouri Department of Health, none of the 6 victims or women were from the state of Missouri. Have you contacted people who have been given the J&J vaccine, or what sort of communication, if any, have you given to those that have taken it, and what are you asking them to do?
Well, we have on our website the information about the pause in the vaccine. We did not directly communicate with all the people that previously received the vaccine. They're actually out of the window of when we've been seeing potential adverse reactions. And I want to emphasize potential. We really do not know whether or not the vaccine is causally related to these episodes of venous thrombosis. So we just simply put it on pause. None of our folks are within the window, which was, I think, 6 to 13 days. It's been 3 weeks since we've given one. So we did not go out and inform people. We did put on our website that if they have any symptoms of concern, including severe headache, abdominal pain, leg swelling, shortness of breath, that they should contact their physician.
And so to that point, Ashton Day, what would you advise someone who maybe got a Johnson & Johnson vaccine, not in Boone County, maybe they went elsewhere but live here? What's your advice to them if maybe they are still in that window within that 2-week period?
Yeah, if they are within that 3-week window and they start experiencing some of those symptoms, as Dr. Blunt mentioned, severe headache, leg pain, those things, then definitely reach out to your doctor as soon as possible. But I mean, that's true of any vaccine you get. If you are having those side effects that are lasting longer than that 24 to 48 hours, we'd recommend you reach out to your doctor just to check in on what that could be.
Sure, and Ashton and Dr. Blunt, a lot of people wanted the J&J one, or some people wanted that one just because it was that one shot. Are people wanting to switch to Moderna or Pfizer as you're rescheduling them, or are you getting people that are just like, you know what, I'm going to wait until the J&J one, hopefully, gets the all clear?
Yeah, I think we're definitely seeing both instances of it. Some people still feel like that is the best choice for them if it does become available again soon, so they are waiting. But other folks, we are encouraging, if they can and if they choose to go ahead and get scheduled with Pfizer or Moderna, because there is a chance they could get both doses sooner. You know, we don't really know how long this investigation process is going to last. So just to get everyone vaccinated as quickly as possible, we are encouraging them to get signed up elsewhere.
Dr. Blunt, I am curious from your perspective. I've heard some people make the argument that there's only 6 instances of blood clotting out of the millions and millions of shots, that maybe putting a hold on giving them out is actually more harmful than continuing with the shots and monitoring for these kinds of symptoms. I don't know if you have an opinion on this argument, if putting a hold is generally for the best, or if should it continue on just based on the really statistically low rate of this happening. Do you have any thoughts or insight into that issue?
Well, there's pros and cons. I would say that really one way to look at this pause is to really reassure the public that we're not pushing things that are still considered under an emergency use authorization. So, I think if nothing else, it should prove that the FDA, the CDC cares about making sure that a vaccine is safe. Reality is there's been about 7 million doses given, six cases out of 7 million, greater than 1 in a million chance. When you really look at the 560,000 deaths, all of the people that didn't die but had severe illness, the 40% of those very severely ill people that survive that have the post-COVID syndrome, there's no doubt we need to continue with the vaccination effort. I certainly applaud, the scientists that are right up there figuring it out for being, doing their best to keep the public safe. They'll look at it. I personally think that the J&J will be back in use before long, but they need this time to be sure they're making the right decision.
Sure. Love the insight. Thank you. Our live conversation about COVID-19 and the vaccines will continue in a few moments here at 6:30. Stick with us. Welcome back to our live conversation on the COVID-19 pandemic.
If you're just now joining us on ABC 17 News at 6:30, we are talking live with Boone Health Dr. Robin Blunt and Ashton Day with the Columbia-Boone County Health Department. Thank you both for sticking around for this conversation. A month ago, and we've done a lot of stories this week about this, where the vaccines were so hard to find. People were having, Facebook pages and whatnot, trying to get those slots. And now there's a lot of slots, it seems like, that are unfilled. Is it simply just supplies increasing, driving that, or do you think there is some hesitancy in getting the shot, or a combination of both of that?
Yeah, I definitely think it's a combination of a lot of things. We definitely have more vaccine than we did a month or two ago, which is great, more opportunities for people to get vaccinated. But there are still those folks who, are still in that decision-making process. They're not sure if they want to get the vaccine yet or not. And so there's a lot of room for education on our part. And so we are working to do that. But I think some of it too is just a lot of folks, we haven't yet reached them, and they're not sure that they are eligible yet. And so, things like this and going out into the public and letting folks know, you can register anywhere. It's easy, it's free. So we are working more to reach those people, to let them know to go ahead and sign up.
Sure. And Ashton, what kind of ways are you going to be educating the public and trying to reach some of those people?
Yeah, online, social media, we have lots of ads running on TV, radio. We're also doing a lot of, just putting posters up all around the county that links to our website and gives phone numbers. And then also kind of just changing the way we do some of our clinics. We do have a vaccination clinic on Monday and Tuesday coming up at the Columbia Mall. Shout out to Boone for letting us use their space for that one. But we are, allowing walk-ins on that day. And so trying to approach it a little differently. That way, if people, didn't hear about it beforehand, or maybe, didn't get signed up, they can still come in and get vaccinated.
certainly see those ads on Hulu that
Yeah.
you're talking about too. Given the current number, Dr. Blunt, of people who've started vaccination and then the number who have completed it as well, when would you expect Missouri to attain a sort of herd immunity?
Well, as much as I'd like to say soon, we're a ways away from that. I think that are we about 36% initiation of vaccine in Missouri, something like that? We're a little ahead of that in Boone County, which I think we're very fortunate. So to get both those shots, I think we're incredibly fortunate that we have a really good supply now. And I think one of the things that can increase vaccination is the idea of allowing walk-ins. It was so difficult to get it first. We had to have people have appointments, but now you can get it so many places. Having it as a walk-in availability, like the county is doing next week, I think that'll encourage some people. We're talking with the county about, where can we go to reach the people that have not yet been reached. So working on all those. I think that phase 3, meaning everyone that can get one can have it, we'll see a big uptick in that too. But really, there's a lot more vaccine available than there was just a month or so ago. So I think we should be seeing progress. How long will it take? I'm hoping that by the end of summer, we'll have a pretty good dent in the number of people that have taken the vaccine. There's still not an actual number that says we've reached herd immunity.
Right.
I want to continue to emphasize to people that having had the disease, having natural immunity is not as effective as the vaccine immunity. If you've had the disease, you still need to be vaccinated. We know that the vaccine maintains immunity much longer, and is that the level of antibodies are higher. So, don't rest back and say, oh, I had it, 4 months ago, I'm fine. You need to get vaccinated.
All right. Thank you both for weighing in. We'll continue this conversation a little later in the show.
Welcome back to our live conversation on the COVID-19 pandemic.
We're talking live with Boone Health's Dr. Robin Blunt and Ashton Day with the Columbia Boone County Health Department. Thank you both for staying with us. Now, I want to start here with you, Dr. Blunt. Getting the shot from a personal physician, someone's personal physician, it seems to be that it would be preferred by most due to the privacy, access to ask a medical provider questions about it. Is that not available right now? And if it's not, when might that be an option in the future?
Well, I think it might eventually be available, and it really depends on the storage capacity, how a private office can maintain the vaccine safely stored. Originally, it was really not possible at all when they felt that when Pfizer had to be stored ultra cold. But I do think that they've lightened up a little bit on those requirements. The J&J vaccine is ideal for physician offices. The only thing is that each vial has to be, there's a certain number of doses each vial, and they have to be used within a certain time frame, which is usually within a few hours. So, they would still have to be able to get the vaccine to enough people and not waste it. And use up an entire vial. But I do think that it would be a great resource, and if we could get them into the doctor's offices.
Sure. And Ashton, this is the very last question. We have about 30 seconds. How are you messaging the vaccine supply to college and university students?
Yeah, we're really trying to just go where they are. I talked about those posters earlier. So putting those up in bars and restaurants, especially in the downtown area, around campus, in student living facilities, really just trying to reach them wherever they're at. And then we're also in close contact with the 3 major colleges here in town, and they all have committees that are working to promote vaccine and help their students get scheduled. So we continue to work with them to create any materials they may need for that.
Ashton Day, Dr. Robin Blunt, thank you both for joining us tonight. If you want to watch this whole segment, you can go to abc17news.com for that. Again, thank you both for being here.
And coming up tonight at 10, we are looking at the precautions Mid-Missouri school districts are taking to help staff recover from getting the second coronavirus vaccine shot.
And I'm tracking rain that's moving in by tomorrow afternoon, lasting into the first part of the weekend. That's going to keep us into the 50s for most of the weekend, but by Sunday, expect more sunshine, getting close to 60 degrees. The warmest day of the next 7 is looking like it's going to be on Monday.
All right, thank you very much, Jessica.
And thanks for joining us tonight, everyone. Hope to see you back here later tonight at 10.